Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. In today's episode, we're talking about prenatal development. Now, prenatal development happens from day one in utero until the day of delivery, and all the things that happen in the developmental phases of that stage of your life. It's important for the dental hygienist to have an in-depth understanding of the pre-developmental phase due to some of the clinical presentations and risk factors that are associated with some developmental disturbances and malformations that occur in the head and neck area as a result of this process. The dental hygienist should understand the manifestation process of some of these developmental disturbances and risk factors. I encourage you to review the Dental Anomalies podcast episode for an in-depth list of some of the types of developmental disturbances that can occur during fetal development. In this episode, we're going to review the 3 stages of prenatal development. Hey, if you're in hygiene school or just got your acceptance letter to hygiene school, I've got a new course to help set you straight right out of the gate when you first start your program to help ensure a successful transition from the first semester to the second semester and to the finish line. I will help you strategize all the key strategies that you need, understand what the challenges are, and overcome all the obstacles. Learning in dental hygiene school is different than any other program. You've got a lot of assessments that are evaluation style. You need to be able to plan and prepare for that and be successful so that you can become an RDH. And I'm here to do that for you. I have a new course, How to Be a Successful Dental Hygiene Student. You can click the link right in the show notes and I'll show you how to get it done. Congratulations on entering this profession. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! In the first stage of prenatal development, we have the pre-implantation period, which is occurring in week 1. In this stage, the process of fertilization occurs, which develops what we call a zygote. There is rapid cell division, and this helps transform the zygote into a blastocyst. Now, the final step in this stage occurs in the ovum, where there's a joining of both parents' chromosomes, followed by the blastocyst dropping into the uterus. Now, once the blastocyst drops into the uterus, this stage has ended. Now that we've finished the pre-implantation stage, we're moving on to the embryonic stage, and a lot happens in this stage. This stage begins in about week 2 and lasts around 4 or 5 weeks. In this stage of prenatal development, that blastocyst implants into the uterus and it starts to take on a different shape. It takes on the shape of a disc. The placenta is formed, and that develops an umbilical system for circulation. And while this is happening, the blastocyst continues to change shape, and that rapid cell growth begins to transform the blastocyst from a disc shape into more of a tube shape. The development of mesenchyme occurs, which will eventually create embryonic connective tissue. The central nervous system begins to form, and the head and tail begin to take shape at either ends of the tube. The cephalic head contains the early formation, or what we would call primitive components of the mouth, known as the oral pharyngeal. The blastocyst tube also contains the early forms of the 3 primary germ layers of the future body. Now, week 3 is a very busy week. The 3 primitive germ layers are the ectoderm, the mesoderm, and the endoderm. It's important for the dental hygienist to know what develops from each of these layers. So we'll review this. The ectoderm is the outer layer, and that develops into the epithelium lining of the oral cavity, the nasal cavity, the enamel of the teeth, the nervous system, and the skin. The mesoderm is the middle layer, and that will develop into the skeletal system, the muscles, the lymph system, the kidneys, the reproductive organs, connective tissue, cartilage, heart, and blood cells. The endoderm, which is the inside layer, develops into the stomach, intestines, lungs, bladder, liver, gallbladder, and pancreas. Week 4 of the embryonic stage starts with a huge transformation of that embryo from a tube shape into a C-shaped structure with rapid cell growth. The neural tissue begins to form from that ectoderm and migrates into the upper part of the C-shaped configuration. This is the primitive start of what will be the future spinal cord. This migration provides the embryonic tissue for the development of the future 12 cranial nerves. Now, other structures begin to develop during week 4, and these are things like the lens placodes, which will be the future eyes, the otic placodes, which will be the future ears, and the nasal placodes, which will be the future nasal openings. At this point in the development, the embryo is about 12 millimeters long. Now, at 6 weeks, a fetal heartbeat can be detected with ultrasound. Think about all that has occurred in 6 short weeks for the formation and development of a heartbeat. Now, the fetal period of embryonic development follows the embryonic period, and this stage begins around 9 weeks or about 3 months of the prenatal phase of life. And this stage continues until 9 months. Now, by 4 months in the fetal period, the movements of the fetus can be felt by the mom. There are 5 physiological processes involved in growth and development of the human body. The first one is called induction, and this is the first stage of development. And we're really unsure of what starts this process, but it's important to know that failure of induction can result in major problems in the growth and development process. An example of this in dentistry would be congenitally missing teeth. The second process is proliferation, and this occurs in 2 ways, by interstitial growth or appositional growth. Interstitial growth increases in size by adding layers deep within the tissue or the organ, and it usually involves soft tissue such as organs, right? Appositional growth, it's increased in size by the addition to the outside layer of the structure. So that usually involves hard tissues such as dental tissues and at the ends of bones. Now, some structures within the body use both types of growth, and examples of this would be things like cartilage, teeth, and bone. And this can continue for a long period of time, the proliferation stage. An example of this in dentistry is the growth of the dentition from infant to the permanent dentition. Now, differentiation is the third stage, and in this process, the cells convert into distinct functional cells or structural cells. They now have specialized functions in the process of development of the tissues and the organs. An example of differentiation in dentistry would be fibroblast cells changing into odontoblast cells that form the dentin. Now, there's a few terms associated with the differentiation process that the dental hygienist should know. So, cytodifferentiation is where the cells develop into different types of cells. Histodifferentiation is when the cells develop into different types of tissues, and morphodifferentiation is when the cells develop into different structures for each of the organ systems. The fourth physiological process involved in human growth and development of the human body is called morphogenesis. And morphogenesis happens after the cells have completed their differentiation process and have divided their location within the body. The cells develop into a specific function or structure, and they continue to evolve, grow, and develop. Now, this process, morphogenesis, will shape the organ or structure as the body develops. The last process I want to talk to you about involved in growth and development of the human body is called maturation stage. And the maturation stage is the final stage. And in this stage, things continue forming and developing. The process just evolves and continues. Now, maturation occurs because of proliferation, because of differentiation, and because of morphogenesis. Through all of them, the correct function of the tissue or organ is reached along with the adult size of maturation. Now keep in mind that during the growth and developmental process that not all parts of an embryo grow at the same rate. As a result, some structures appear to move closer together when in fact they're actually moving further apart. So an example of this would be the movement of the ears. There's a series of small bumps located low and far forward. And the growth, the differential growth that happens, will result in the proper placement of the ears. And the growth of the lower part of the face is faster than other areas of the embryo. So it's apparent that things produce an upward and backward relocation of the ears. And this is a perfect example of differential growth. So movement of the eyes, it almost looks like fish eyes at the 4-week stage. And the eyes appear to no longer be located on the side of the head, but they appear to rotate towards the front. They actually look closer together. However, in actual distance, the eyes are further apart. And this is just an important concept to keep in mind as you're going through the growth and development process, that the differential growth that occurs might seem one way, but it's actually occurring another way. It is important for the dental hygienist to know when some of those developmental disturbances can occur in utero. And they can occur anytime during pregnancy, but the most common malformations occur in the first trimester. And sometimes it's from environmental agents like drugs, chemicals, infection or illness of the carrying mom, or radiation exposure, things like that. Now, most of them occurring in the first trimester, keep in mind that a lot of times, oftentimes, people don't even know that they have a developing fetus in that length of time, that first 1 to 8 weeks. Now, many prenatal development malformations can be prevented if the mom is educated about health issues and diet. And this is much easier to do when the woman is trying to become pregnant, right? So you remove those environmental risk factors that someone has control over, such as drugs, alcohol, tobacco, radiation, or diet situations. And this will help alleviate and remove some of those developmental disturbance probabilities. But oftentimes there's an unknowing, right? There's a unplanned pregnancy where those really crucial weeks are really important, and someone might not be aware that they have a developing fetus. It's important for the dental hygienist to learn when tooth development happens during the prenatal development process, as well as the dental disturbances that occur in the weeks of those development processes, when they occur, how they occur, and what happens as a result of those developmental disturbances. So we know that the primary dentition starts in the embryo and that the permanent dentition starts to develop around 10 to 12 weeks in utero. And we also know that it takes several years after the birth of a child for that maturation to continue. And the teeth have the longest developmental period of any organ within the human body. So we know all of these things. So reviewing the tooth development and eruption and reviewing dental anomalies will help you put all the pieces together. Take some time to really think about how you learn best and what you've learned about yourself as a student enrolled in a dental hygiene program so far on your learning journey. Use what you've learned and those strategies to develop easy ways for you to learn this material. Now, there's concept maps that you can use, maybe flashcards, maybe creating questions for yourself to help develop a solid understanding of the content. Thanks so much for listening today. Join me next time where we're taking a look at the prenatal development of the face specifically. It will review the process of the development of the face, the palate, and the tongue. It's important for the dental hygienist to understand the process, the timeline, as well as some of the developmental disturbances that can occur during this phase of development. You won't want to miss that episode. I would invite you to ask any questions at all that you need answered. Sometimes questions come up when you're listening to this podcast. If you have a question, most likely someone else has the very same question. I'd be happy to answer it and would probably share it in a future podcast.